Hey everyone, welcome to Garner Insights. I'm Reber. I'm the founder and CEO here at Garner. And for those of you who are new, Garner is a simple plan addition that uses data science and incentive accounts to drive employees to the best performing individual doctors. Now, recently we've been focused a lot on the latest healthcare transparency data, which gives us a lot of powerful information on the real costs of healthcare. And today I wanted to share some of our latest analysis which uses this data to show the relationship between cost and quality in healthcare. In other words, if you pay more, do you get higher quality care or not? And as you may remember, with the new transparency data, we can now finally know just how much healthcare services really cost. So to take a simple example, here is the cost of a total knee replacement here in New York City on the Aetna network. And these are the actual prices paid by the employers and the employees. You can see that the price varies by more than $40,000 in the same geography, from low-cost doctors to high-cost alternatives. And we've had a lot of folks write in and ask questions about this, saying something like, of course there's a large difference in cost. You always get higher quality when you pay more for anything. And in fact, in most of the economy, high cost does in fact equate to high quality. So today we're going to show some data on that and then talk about healthcare. So to start, here are the prices of homes in New York City. You've got the sale price along the horizontal axis, and on the vertical axis you've got the size of the home. Most people would of course like to live in a larger home, and so that's a notion of quality. And you can see that indeed larger homes, as measured by the number of square feet, it creates a higher cost and a positive relationship. So high cost equals high quality, pretty simple. And now we can take another example and look at New York City restaurants and the quality of the food. And here we're showing the Zagat ratings, which is an expert opinion on food quality. And again, you can see a positive relationship where high quality food tends to cost a lot more. Just what you'd expect. So now let's change and look at the data on healthcare and see what it shows. If we look at the same cost of a knee replacement in New York City, we can compare that to the complication rate after that surgery. And now when we pull the data, you can see that there's actually no relationship whatsoever. So you may think, okay, well that's just one metric, so fair enough, let's look at a few others. What about the revision surgery rate? That's whether patients need another surgery after the first one. And it turns out there's no relationship there either. Well, what about pain relief rates? We see again no relationship. And we can keep going, and if you look at bedside manner and patient reviews, the patient review score again has no relationship to cost either. And this, it turns out, is very consistent across the entire country. As we've examined every geography and every specialty, there's almost never a relationship between the cost of a service and any of the quality metrics we track here at Garner. So why is this? Well, it's because in healthcare, consumers don't have the information or the incentives that they need to make an informed decision. So unlike shopping for a restaurant or a home, consumers don't know actually how much that surgery or that service is going to cost until after the fact. And furthermore, most people have health insurance, which means they're going to be through their deductible and out-of-pocket maximum anyway, so they don't actually feel the financial burden of making an informed decision based on price. So all of that means that price is not related to quality in healthcare. So now we want to take this one step further and look not just at the price of a single service, but the total cost of an episode of care over time. And it turns out that low quality care actually leads to more cost over time. Well, what do I mean by this? If you look at the total cost of an episode, you can see that if there's low quality, you start adding additional cost to the total bill. So for that knee surgery, a complication costs you money. A revision surgery costs you a lot of money. Same thing with an inappropriate surgery that shouldn't have occurred. And if another surgery is necessary or follow-on care, you guessed it, that also costs you a lot of money. So when you look at the cost to treat knee pain over time, you see this relationship where high quality actually results in lower cost. And that's the opposite of almost everything else in our entire economy. In healthcare, high quality equals low cost because patients are healthier. And at Garner, you may know this is what we do, and this is what we mean by top performing providers. Here, the top providers in New York City that treat knee pain lower costs by 35% and have significantly lower sick days for their patient. That means patients are healthier, happier, and back to work faster, in addition to lowering total costs. So this creates a significant opportunity for employers and for their advisors. If you're thoughtful about how to structure your health plan, you can actually get better quality care and pay less at the same time. So that's it today. If you're interested in cost and quality, or you want to see this information in your local geography, please send us a note. We'd of course love to hear from you. So thank you and have an awesome day.